You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. I'm Dr. Tudor Francu. I'm your host for Stellar Success Podcast again. I have a great guest tonight, Dr. Leslie Pasco from all the way from Pittsburgh, Pennsylvania. How are you, Dr. Pasco?
I'm doing great. Thank you. Thank you for having me.
Sure, absolutely. Glad to have you here. So, Dr. Pasco, you're someone who can relate a lot with the medical practice, also with the business aspect of it. What do you think success means to you?
Well, I think it used to mean how successful I was with my patients and, how they got better and how quickly they got better, how they responded to treatments. But as the years went on, I came to realize it's more than just the success with your patients, although that's a big part of it, but it's the success with your practice. And that really includes your team, the practice environment, the culture, the finances of the practice, marketing, all of that. And so I think in a nutshell, it's hard to pinpoint on just one thing that would define success. I think it's accumulation of all those things.
Yeah, absolutely. That's a good way to put it. Can you give us a little overview of where your practice is right now? How did you start, things along the way, and how did you come to where you are?
Sure. Well, I'm a dentist. I didn't always want to be a dentist. I wanted to be a cardiologist. I showed up at I showed up at a dental appointment, and the dentist was like, "What are you studying?" And I said, "I want to be a cardiologist." And he said, "You should be a dentist. It's a great profession for women, and I think you'd really like it." So he invited me to come into his practice and observe for a day, and I instantly fell in love. Because it was a combination of art and science. So art with your hands, you have to be good with your hands to be a dentist. But and then it was during like the makeover days and things like that too. So, I saw a lot of the artistic side of dentistry, but the science part was really cool too. So I put down the medical journals and decided to apply to dental school. And I applied, I got in early, which was really nice. And I fast tracked my career. I got out of dental school. I worked as an associate for a little while for the same guy that got me into dentistry in the first place. And then I decided to have my own practice. Throughout the years in dentistry, I've owned my own practice where I've worked in it. I've worked outside of it. I've just run it. I didn't work inside of it at all. I did consulting. I did lecturing, seminars, speaking. And anyway, long story short, where am I now? I don't have a dental practice. I actually sold my last practice about a year and a half ago. And I retired from clinical dentistry. And now I'm focusing my attention on myofunctional therapy for children to help their jaws and airways grow properly at an early age. So hopefully they can avoid all the things that go along with sleep apnea.
Oh, that's very interesting.
Yeah, thank you.
We'll talk more about that, but I want to go back into what you said and the fact that you're someone who comes from a clinical practice and run the business, like you said, not in the business, but for the business. How do you see someone learning all those skills that you need to have a business in the first place? Not being successful in your business, but just to run it. This is something that we don't learn anywhere in school. It's kind of a practice, so to speak, by doing it. But do you think there's any skill or habit that you necessarily have to be able to do that?
You have to have drive and you have to have discipline. And it's very easy to do the clinical aspect because, like you had mentioned, we're taught that. So it's our comfort zone. Being willing to step outside that comfort zone and look at the bigger picture and how that bigger picture can benefit your entire practice, not just your patients, but the team and the establishment and the profession really, is something that has to be done, even though it's not taught. So the discipline to look for it and research it and enlighten yourself and teach yourself the tips and tricks and tools of running a business. And I realize that's hard because as a practicing clinician, your time is limited. But finding the right ways that you can implement that education into your world is really important. So whether it
Yeah,
be an Audible book or, just one publication or one mentor that you look to that you read maybe a couple pages per day from some sort of book or publication, I think that would be very helpful.
yeah, talking to a lot of people that are doing what you're doing, this combination of like medical professional slash businessman or businesswoman, it seems to me that there are certain characteristics that someone needs to follow in order to be successful in what they're doing. And you mentioned a couple of things, getting a mentor, listen or reading books, maybe have some, meditation with yourself and thinking what you're doing and planning things out.
Mhm.
Do you have any kind of habits that do you think, helped you being successful in your practice?
For sure, planning, strategic planning on both short and long term aspects. So, every week I plan my next week. I plan what my top three big actions are, and those big actions are going to support my long term goals. It helps keep me on track and on focus for what it is I want to accomplish long term, so that I can make sure that what I'm doing every day is supporting what I'm trying to accomplish that way. Making use of my time efficiently, and I use block scheduling for myself. So I have, days that I reserve just for being present and in front of people and talking to people, kind of like today. Mondays are my days for that. And then I have other days where it's kind of like behind the scenes, and that is more engineering my vision and planning and growing and expanding and dreaming and having time for that. You got to build that into your schedule, because if you don't schedule it into your schedule, it generally doesn't happen. It just becomes something that you'll get to eventually. But putting that time and effort into planning, but then also scheduling time to plan, and also scheduling when you're going to do certain types of activities, to me that's critical. Otherwise time just slips away, and before you know it, so much time has passed and nothing got done.
Yeah, I agree. I agree. Planning is something that I like to do also, and it's not necessarily that something is going to go as planned, but in my mind, that's something that needs to be done. Not necessarily when or how, but just have it written down. Uh, we don't learn too much from success. We learn a lot from failures
Mhm.
and from setbacks. Um, it's maybe sad sometimes, but it's necessary. Do you have any moments, or did you have any moments like this in your past that kind of made you think and push you forward more
Mm.
than anything else?
Yeah, certainly, absolutely. The first moment that comes to mind is it goes back to sort of what I was saying, not making plans and not setting aside time. Years ago, when I was building my first big dental practice, I had an amazing associate dentist in place, and he was fabulous. He was just like me, and it was exactly what I was looking for to replace me, so I can kind of get up and out of the chair side part of the dental office. And he approached me multiple times, to talk about growing with the practice and partnerships and things like that. And I just somehow or another didn't, I didn't give it the value that it needed, and he slipped away. So it all worked out for the best. He has his own practice, and he's happy, but I could have made that a better opportunity. So I didn't have a long-term goal necessarily set in place or solidified. I didn't make time to meet with this person or this individual to discuss it, and I didn't put any priority on it. So I guess the lesson learned in that is, if there's something that is valuable, you make time for it. Yeah.
Yeah,
And I think the second thing I would say is sometimes bigger isn't always better. And sometimes growing too fast, too quick, when you can't manage it or handle the territory that you've grown, that could turn out to be disastrous. So I would say, when you have a good service and your good chairside or bedside manner, and your practice is growing and growing and growing, just make sure that you can handle that in the right way, so that it doesn't become too stressful for you when you have a breakdown or the practice breaks down. Yeah.
yeah, interesting.
Hmm.
Interesting. It's very true what you said. Now, um, it's interesting. You developed a practice, you sold it, and now you're moving on with other things. How is the process of exit strategy for you? Because a lot of people in medical field and healthcare, small business owners like yourself, they're thinking about the same exit strategy, and very few people accomplish it. What kind of advice would you give to someone like yourself who wants to do that?
Oh, that's a great question. I have 5 steps for that actually, and I'll share those steps with you. The first step is that you have to make a firm, non-negotiable decision with yourself to do it, and then the second step is to make a firm, non-negotiable commitment to do it. So, for example, when I decided I wanted to step out of clinical dentistry and just turn the kit and caboodle over, to the management and the team of doctors. I first decided that that's what I wanted to do, and I made it non-negotiable with myself. I couldn't waver back and forth and say, well, this patient really wants to see me, or nobody knows this patient like I do, or nobody can do it quite as good as I do. I had to make that decision and make it non-negotiable. But then the commitment step is I actually announced it to my team. This is what's happening. This is what's going on. And then I remember when I made that announcement, I saw a patient right after that, and I said, this is the last time I'm picking up this handpiece. And that was the end of it. And so that commitment kind of solidified the process. After that, I surrounded myself with all the right people to help keep me in that position, people that had the same thoughts and feelings and goals that I did. In other words, they didn't feel like they needed me there in order for it to run, or, I had to get called in, for this one patient that only wanted to talk to me. Like, the right people were in place, and I got them the right training and gave them the right motivation to be able to support what it was that I wanted. And then and only then could I really start to systemize and organize the processes and flows, because what I had found throughout my career was, if you don't have the right people in place and you haven't made that firm, non-negotiable decision and commitment, but most importantly, the right people, whatever system or process you try to put in place, it just doesn't stick. So a lot of the times what I find with healthcare practitioners, especially dentists, is we're very technical people. We like graphs and charts and flows and all that good stuff. And we tend to get drawn towards that or attracted to it. So it tends to be the first part that we put our attention on. But if you do that and you don't have those other 3 steps in place, then those systems, whatever you try to organize, it just won't stick. It won't flow. Right. So, and then let's see. And then after the systems and the organization, then it becomes creating your legacy. It becomes being the face, the motivation, the legacy behind the organization that you built, and getting more and more people involved and on board and motivated to support what it is that your dream is. So my dream was to create a big, successful dental office that was the most well-known dental office in the area, that when people thought dentistry, they thought us. And that's what I created. And then you have to realize, though, too, that when that time comes, don't overwork it, don't overthink it, but take the exit at that point and say, this is where I am. I'm finished. It's time to move on. You've got to be willing to let go. Yeah.
Interesting. Yeah, that's a very great approach for psychologically for someone to take those steps, because it's, like you said, it's very hard for someone who builds a business like that by yourself to just go away. Unless you have some clear marks on the territory for that. Did you use any brokers? How did you sell the practice?
Yeah, so actually, I've sold multiple practices. My first practice, I grew and I sold. I used a broker for that. Yes, I bought other practices and never stepped foot in them, but ran and operated those as well. So I used brokers for that. Yes. And then my most recent practice that I sold, yes, I used a broker. I suggest that you find a broker that you can relate to, that thinks the same way that you think, and that has the same motives and agenda that you have, because not all do. And there was one time I used a different broker than I normally used, and that was the one time it didn't go right. So I would suggest, find someone that you trust and that you feel comfortable with, and and use that person, and make sure that you're really conveying what it is that you want to achieve, and in no matter what, always convey that, because no matter how silly you think it is, like, I want to sell this practice in 2 months. Well, make sure you convey that message, because it's good for that person who's helping you to know that, even if you think it's not accomplished, it can't be accomplished, you should express that. Yeah,
I see. Yeah, very interesting. Well, obviously, I want to touch on the financial aspect of being a business owner, and being a business owner who is not a business owner anymore. Are you a busy medical professional striving to excel in life and work?
Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
How do you see the exit strategy for your finances when you don't want to do anything anymore and you just want to so-called retire? Although I'm sure something else will pop up, but financial strategies that you can use and you can advise someone to do, because I'm sure with your experience you can teach someone a thing or two.
Oh, well, thank you. Sure. So what I would say is, like, if you're at the end stages of the game and you don't have that financial strategy in place yet, it's going to be tough. Your practice is never really valued at what you think it's worth because your heart and soul is into it, right? So it's always worth much more to you than it is to the broker or anybody else. So you have to realize that. And you can't be disappointed if it doesn't quite come in where you thought. That said, it's really best to get a jump start on that financial strategy long before you're considering what the exit strategy, right? So, early on in the career of the ownership, you should be planning your exit strategy first. So when I went over those 5 steps in the legacy, part of that legacy is, well, what does it look like when I'm done? How much money do I have in the bank? How much money do I want to leave to my kids? How much, even if you don't have kids yet, start thinking about those things, because you've got to have the end in this case before you have the beginning, ideally. And that's really what's required in order to meet your financial goals. Most people don't think about it until the very end, and I would suggest that you don't do that. So wherever you are now in your career path in medicine, I would start thinking about it immediately and looking at that legacy long before you're trying to make that legacy a reality. Then the other thing I would say is making sure you separate your finances into different categories for running the practice. So I always had an emergency fund, something that was always there that nobody knew about, not even my bookkeepers. So I would always just give money to the bookkeepers to say, this is what you guys have to spend, figure out what you need to pay. And then the rest I would set aside in different accounts. One for marketing, because you always have to support your marketing, depending on what kind of medicine you're in and how you're working. One for a rainy day, and one sort of for reserves, just in case it's not a full emergency, but it's something that you really want to do and take care of. And then hopefully none of that stuff never comes up, and then you have this nice little pot, on the side for your emergency or reserves. But that's really helpful. Like you pointed out, they don't teach us any of this stuff in medical dental school, so we don't have that knowledge coming out. And I also think where a lot of young practitioners, professionals, they come out of school, they've put all these years and all this money into going to school. Now they just want to live their life so they can be extravagant. And I know I did it too. It's a big mistake. Try not to do that, because, you're not setting up for your future early enough then. So start right away.
Yeah, that's a great advice. Great advice. And I think you touched on a few very important things. And I think one of the most important thing that I would say is the fact that, you lose probably 10 times more at the end if you start investing. And I think, whatever you can afford, nobody asks you to invest a lot of money, but just a little bit, starting with residency or starting, right off medical school, it's going to compound at the end to amounts that you cannot even imagine right now.
That's right. Yeah, it has to be disciplined, and you have to make it a habit.
Right.
Exactly. Right. And I think also too, if you're owning your own practice, investing into the practice, but not over investing either, because you want to put money into the practice to keep it going. So if you're going to sell it someday or something like that, it has more value. But I see a lot of practitioners, because that's what they know. Like we pointed out here today, they go to school to become these clinicians. That's what they know. So that's what they invest in. They don't know about money, so they don't tend to gravitate towards that subject.
Yeah. This is why I'm doing this. I hope, people get some insights and advice from successful people like you that can translate in their own practice. And the fact that in healthcare, having a business, it's mainly the only investment some medical professionals do, because they don't know about money in general. They don't know about investing, and their business and their clinical practice is the only thing that they can invest in. And the exit strategy is the most important thing. They can retire after so many years of practicing. You are someone who did this multiple times, and knowing what you know right now and with your experience, looking back to yourself when you started, what kind of advice would you give to yourself?
Oh, that's a good question too. Wow, that's a thinker. You know, I would just say keep doing what I was doing. I would say, well, I think
Because
I
you
would
did
say,
the right
like,
thing.
yeah, I think I did some good things there. I mean, I definitely, and I think one of the right things was learning from my mistakes and not giving up. And that's what I would continue to encourage myself to do: is don't be afraid, don't give up, keep going. Keep all your ducks in a row, but also be willing to take some chances and some risks and have fun while you're doing it, and do good for people. And when you do that, the right things always happen. So I think that's how I would probably talk to myself. If I could talk to myself back then, I would remind myself, especially during those stressful situations where I thought, oh, this is never going to happen, or this is going to crash down, or I don't know if I can do this. Keep pushing, Leslie. That's what I would tell myself. Just keep pushing, and don't be afraid. Keep going on.
Yeah, absolutely. I think you said something very important. Creating value for some other people is the most certain way you're going to be successful in what you are doing, because giving back, it's probably the most rewarding thing you can do at the end. And I think we all have certain standards, I would say, to help others, coming from a medical point of view, as a clinician too, but also as a businessman or businesswoman who did all this, transaction, so to speak. Giving back to people, it's something that you can be successful too.
Yeah, as healthcare providers, that's what we do. We're healers, and it's not always just physical healers.
Right.
Sometimes the good things that you do that heal someone physically goes so much further than what you think. So, and when you take an approach to your profession that way, everything just organically happens the way it's supposed to.
How would you advise someone who wants to start selling their practice, having an exit strategy from that? What would be like the few first steps to take?
The first step to take would be kind of get with the modern times, because anybody who's coming to look at acquiring your practice is probably going to be of the more modern approach. So that means whatever the modern computer software is for your profession, the materials and the technology that you need to use. I don't want to see you drop a ton of money into it, but I'd also say don't be afraid to spend some of it, because that is going to be more attractive to a buyer. Whether that buyer is an individual buyer or a corporation, a hospital, anything like that, they're going to look for those things. And then I think one thing that has always helped me, as silly as it sounds, and I've been doing this for a very long time, someone had suggested I do it, and that's how I actually found that perfect associate way back when that I lost. Take a sheet of paper and write down exactly what you want. Exactly what you want it to, and don't be afraid to, no matter how silly you think it is or how unattainable you think it is, write it down exactly what you want. Bullet point it if you want, write it in a story, whatever works for you, but write it down exactly what you want and how you want it and exactly what it's going to look like. Dream it up, put it on paper, and then I suggest you carry that paper with you everywhere you go, and you read it often throughout the day, and you just keep putting your mind and your intention on that, and it keeps you on track. And without getting into all the physicalities of quantum physics and mechanics and all that stuff, but it does somehow pull all that what you want to you. And so that's where I would start. That's where I would start. I'd start building up my practice, making it attractive, and I'd start really creating what I want that whole process to look like. Yep.
Yeah, putting it down is very, very useful. I've heard a lot of successful people doing the same thing, written down the goals. The power of written word it's so powerful. And like you said, read it every day. Put it on your bathroom mirror or something,
Hmm.
when you go there every day. But yeah, it's unbelievable. I wanna tell us more about the new project that you have
Oh
right
yeah,
now.
sure. Yeah,
So what's going on?
when I retired from clinical dentistry, I had two paths. I was either going to ride off into the sunset and vacation and travel with my husband, or I was going to pick up a new project. And this new project was sitting, there in my heart all throughout. Not want to say all throughout my dental practice history, but for the last 10 years of dental practice. And sleep-related breathing disorders in children have become so prominent. And some of it is related to the biochemistry, but a lot of it's related to just how the child's facial structure, jaw and airway, is growing and developing. And because we're becoming more mouth breathers than nasal breathers, our airways, our jaws and our airways are compromised in their growth. And so I've been seeing this in the last 26 years that I've been in and out of my dental offices and coaching and consulting other dental offices. I've seen that this is a problem. So when I retired, I couldn't ignore it. I just said, I had the opportunity to do what you and I said, like really help people and serve in a different way. And so that's what I did. So I created a center that's focused. It's called MyoWay Centers for Kids. And the tagline is grow right, breathe right, live better. And what we do is we use myofunctional therapy and FDA approved myofunctional appliances that children wear to actually grow their jaws and their airways properly so they can breathe and so they can function like they're supposed to. Crowded teeth, grinding teeth, missing teeth, impacted wisdom teeth, enlarged tonsils and adenoids, ear infections, bedwetting, hyperactivity, focus problems, those things are related to a child not breathing right. So if we can just get them breathing right at an early age, and we can start as early as birth, and ideally before the age of 6, since that's when 60% of the facial structure is developed, we can make a huge difference in a very short period of time, like in 6 months, 6 to 8 months time. So that's what we're doing. We're 7 months old. We're a facility located in the Wexford, Pennsylvania area. We're doing really well. We've had over 100 cases. There's no one doing it like we're doing it. I figured out all the programs and the protocols and all that stuff. We're getting great results, and parents are really happy. They're noticing that their kids are sleeping better. They're not tossing and turning. They're not having night terrors. They're not snoring, grinding their teeth. They're developing properly. Their behavior is better. They're making better food choices. So it's just a win-win for everyone. The parents are really happy, and the kids are doing better too. So
Yeah, that's
that's it.
amazing.
Thank you.
That's a great great goal and great purpose of this whole thing. And
Thank you.
it's a new business, right?
Hmm. Yeah,
What's
brand new.
what's the exit strategy on that one?
Well, the exit strategy started in the beginning when I planned and put this together. I'm not in the facility at all. I have therapists, and I'm the face of it. You'll see my face around with it, but I didn't start seeing any clients or patients right from the beginning. And the intention is not to do so. Even though we're getting busier and it's getting harder to get people in, we're just going to add another therapist before I can jump in. I'm an orofacial myologist as well. I can jump in and I can do it. But I'm going to make that firm, non-negotiable decision and commitment, and I'm not going to do it. I'm going to empower other people to do it.
Yeah.
But the exit strategy is within the next 5 to 7 years to multiply that, whether it be brick and mortar locations and or virtual options, because we offer those too. And then I'd like to pass that legacy on to someone else who wants to take that legacy over as their dream and their vision.
That's awesome.
Thank
That's a
you.
great plan.
Thanks.
So how can people get in touch with you and learn more about what you're doing and maybe reach out for help?
Oh, yeah, sure. I think probably the best way is just to email me directly. It's nothing fancy. It's just drlesliepasco@gmail.com, all lowercase. If you're interested in the MyoWay Centers for Kids, you could check that out. You can also reach out through there to me. I always get all the messages forwarded to me. So that would be myowaycenters.com. And I think that's probably it. That would be the best.
That's great. I'm sure this will be another successful business you're running and selling. And I wish everybody can reach out and not only learn about this one in particular, but in general about your approach to how to make a business successful. So maybe we'll circle back in a couple of years to see how you're doing.
Oh, that would be great. I would love it. It's been a great time with you. You have great questions. You made me think, and I like that.
Thank you very much for being on.
Well, thank you for having me. I really appreciate it.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.